Have you ever had a sharp pain in your heart or the sensation of food backing up from your stomach? If the answer is yes, you more than likely experience two of the main symptoms of gastroesophageal reflux disease, better known as acid reflux and heartburn, or GERD. I myself didn't realize that acid reflux and heartburn were among the symptoms of the disease. I first made the connection when I was 17. If left untreated, GERD can interfere with daily life as well as lead to further complications such as the destruction of your esophagus' lining or more consequently esophageal cancer. While some people don't even realize or acknowledge that they encounter acid reflux and heartburn, gastroesophageal reflux disease is the third most common gastrointestinal disorder in the United States. I experience symptoms of GERD daily, sometimes reoccurring multiple times a day. By understanding what GERD is, its symptoms, and causes and proper treatment, most people find relief. According to the United States National Library of Medicine, gastroesophageal reflux disease is a condition in which the stomach contents, whether it's food or liquid, flow backwards from the stomach into the esophagus. Your esophagus is the connecting tube that runs from the mouth to the stomach. The stomach produces hydrochloric acid, which aids in digestion of stomach contents. Unlike your stomach, which has a protective layer, the esophagus does not. Located near the bottom of the esophagus is the circular muscle known as the esophageal sphincter. Normally when you swallow, this muscle relaxes, allowing food to pass, closing afterwards so that the stomach contents do not flow into the esophagus. People with GERD's esophageal sphincter relaxes while swallowing, or in between swallowing, allowing the stomach contents to flow into the esophagus. I usually explain to people that my esophageal sphincter tends to stay open or doesn't close when it properly should. Since the heart is in front of the esophagus, the word heartburn comes from the acid burning the esophagus. Heartburn. The burning sensation in your chest is the most common symptom of GERD. When I experience this, I often feel like there's food coming up from my stomach right above the stomach opening. Or I'll feel like there's a chunk of food stuck in a section of my esophagus. This sensation of food-filling stuff comes from the pressure that heartburn creates. On top of that, I'll experience a sudden, sharp kind of pain, and it's the kind of pain that kind of creeps up on you too, kind of like an attack that could last up to 2 hours. Oftentimes I'll be left with a hoarse throat or a bitter taste from the acid buildup, especially the next morning after lying down flat. Other symptoms include nausea after eating, coughing or wheezing, difficulty swallowing, hoarseness, hiccups, the feeling of being bloated, or sore throat. The burning, pressure, or pain are all increased by several causes. Eating habits, lifestyle, medications, and certain medical conditions all contribute to symptoms of GERD. What you eat and drink can serve as a main cause to acid indigestion. Fried foods, chocolate, garlic, onions, mustard, mint flavorings, caffeine, citrus foods, tomato-based products, and pretty much anything spicy all weaken the esophageal sphincter. Unfortunately for me, all my favorite foods tend to be under the do not eat category, so it makes it more difficult to avoid them. So whenever I do eat the foods I shouldn't be eating, my stomach tends to feel upset afterwards. In addition to dietary causes, lifestyle choices can have a large impact. For example, obesity, posture, and consuming alcohol or tobacco products can contribute to GERD symptoms as well. My first year in college, I went out a lot and drank, and the next day I usually find it hard to keep my food down because of the weakening of my esophageal sphincter that the alcohol had caused. Correspondingly, certain medications such as calcium channel blockers, antihistamines, nitrates, and medical conditions such as pregnancy, diabetes, and rapid weight gain can also contribute to acid indigestion. If you don't maintain your lifestyle and diet, the symptoms will only get more severe, interfering more with your daily life. There is no known cure for GERD. Most doctors recommend treatment that has to do with dietary and lifestyle changes. Anything that contributes to the reducing of the damage done to the esophagus lining is considered to be treatment. Avoiding certain foods and changing your routine before bedtime can also have a large impact on whether or not you experience GERD. The The three main things I try to avoid are not eating in large portions, not eating right before I go to bed, or not lying down flat when I go to bed. When I eat right before I go to bed and then lie flat afterwards, I feel my food literally get stuck here in my esophagus. WebMD recommends sleeping on specially designed pillow wedges that allow gravity to reduce the reflux of stomach contents in the esophagus. I personally find that laying more elevated helps me to be more comfortable. People whose lifestyle consists of drinking and smoking are recommended by doctors to obviously avoid these habits. Obese people find relief in exercising or losing weight. Along with dietary and lifestyle changes, doctors also recommend over-the-counter prescriptions or regular prescriptions. However, some people with more severe symptoms that aren't treated or aren't relieved by treatment may have more serious complications. When there's too much acid buildup in the esophagus, esophagitis occurs. Some people who have esophagitis may have the condition named Barrett's esophagus, which doctors believe to be the start of esophageal cancer. Now that I've learned what GERD can potentially develop into, I have changed my lifestyle routine, my daily routine, by avoiding certain foods, exercising regularly, lying down flat when sleeping. With the knowledge of what GERD is, its symptoms, its causes, and proper treatment, most people can maintain it and find relief. Although it interferes with daily life, GERD is rarely fatal. Despite that all of y'all are now aware of GERD and what it entails, the majority of the adult population still overlooks the third most common gastrointestinal disorder in the United States.